I wanted to take this opportunity to talk to you today about my perspective in treating chronic pain with pain medications that are in the opioid class, narcotics, things like Percocet, Vicodin, and some other higher-powered medications. There's been a lot of talk and a lot of attention in the media, both locally and nationally, about the dangers of these medicines, and for good reason. I don't usually recommend people get their medical information from the TV and from the newspapers because it's not always accurate. But in this case, there's a lot of truth founded in the concerns that we're hearing about. I'm an old guy. I've been out of training for 18 years now and been in practice here in Rutland primarily during that time. And in my specialty, we treat a lot of chronic pain and disability. And so really seeing how the perspective for treating chronic pain with these medications has made a 180-degree turn in the last 15 years is pretty amazing. We've seen a lot of research in a pretty short period of time. And I think when people go to a doctor and they talk about different medicines, they're really depending on their doctor and the relationship with the doctor so that that physician helps guide them through treatment. And unfortunately, when you're not necessarily involved in the medical field, you tend to think things are pretty black and white, but they aren't always. Things are pretty gray. And actually, the longer I get out of my formal medical education, like medical school and residency, and really have practical experience in treating people, as well as the changes that always happen in medicine year to year, there are really some big changes in how we've dealt with this problem. When we think about how we got into this problem in the first place, back in the mid to late 80s, there was some research that came out that now we know wasn't great research. It was fairly weak in strength and quality. It was a case study, there were low numbers, and really the doses of the medications that were being used at that time were also fairly low by today's standards. But what we've been able to see is that opened the floodgates for being a little more lax about the prescription of these pain medicines in the non-cancer population. And so what we've really seen on the heels of that research is that the prescription of these medicines has exploded over the last 15 years. I mean, it's exponentially increased. And as the prescription of the medicines has increased and the use by patients, the unintended consequences have been pretty dire. And we're really talking about deaths. But for the survivors of the use of this medication, our outcomes aren't as robust as we had anticipated. We're not seeing a documented improvement in pain or restoration of function or even quality of life. So the fortunate aspect is that some good literature has come out in the last 10 or 15 years, but it doesn't paint a pretty picture. The United States is the #1 producer and consumer of opioids in the world. And some pretty scary statistics have come out. Enough pain medicines were prescribed in 2010 to medicate every adult in the United States around the clock for a month. Estimates of death from these substances, it's anywhere from 16,000 to 40,000 per year. We don't have really accurate numbers on that, but those are staggering numbers. The number of people that have died from unintended overdose is over 3 times as many people that died in the Vietnam War. One of the things that scared me the most was hearing that overdose deaths were greater than the number of deaths due to motor vehicle accidents since 2008. And this isn't only because people are misusing the drugs. It's not that people are making a conscious decision to use them to get high or to sell them or to do whatever else they might do with them. Now there are estimates that over 50% of the deaths have to do with people thinking they're using them correctly, taking too much or getting prescribed too much. And this is obviously a big problem that we need to fix. This is the worst man-made epidemic and disaster in modern medical history. That was according to Gary Franklin, who's a neurologist and the medical director of labor and industries for the state of Washington, a very prominent researcher in this field. That was during a presentation to the North American Spine Society last year. So whenever we as physicians talk about treatment for pain, we want to talk about a risk-benefit profile. We've talked about some of the risks. including the worst risk, which would be unintended death. And those are high numbers for that. But we also see that the numbers are very high for potential addiction. We didn't have strong numbers until recently. There are a couple studies that came out just in the last 3 to 4 years that have talked about an addiction rate in one study being around 35% and another study being between 4 and 26%. Those are very large numbers. This relates to about 150 people being addicted for every one person dying from opioid overdose. That's over 2 million people in the United States, using numbers from 2010. A lot of new research also points to multiple other potential adverse effects that we really didn't recognize when this whole movement started back in the 80s. Respiratory and breathing problems really are very prominent. Stopping your drive for breathing, especially at night, can lead to death. There's also an increased risk of developing infections like pneumonia. And in folks with COPD and emphysema, it tends to worsen their pulmonary function or lung function as well. In the elderly particularly, there's more of a risk for thinning bones and then broken bones associated with falls and decreased balance. We're talking about pretty big fractures here too, hip, pelvis, and other extremities. A lot of gastrointestinal side effects. Constipation doesn't really sound like a big deal until it progresses into intestinal blockage. Nausea and vomiting are very common with these medicines. There are a lot of hormone effects with these medications, whether it's erectile dysfunction, low testosterone in men, infertility, menstrual problems in women. It decreases your body's ability to make cortisone, which is a very important steroid and precursor to many hormones. Growth hormone suppression is also seen in younger folks. A few of these medications are linked to developing very severe cardiac rhythms that can result in death. Low blood pressure can be seen, seizures. There's a phenomenon called opioid-induced hyperalgesia, which is more recently getting attention, and it looks like the higher the doses of these medications that people are being prescribed, the more receptors the body makes, and so the pain level can become higher, and the need for these medications also needs to escalate just to provide the same amount of pain relief. There are numerous psychologic problems attributed to these medicines, whether that's an increase in depression, apathy, anxiety, and other mood disorders. One prominent researcher relates degeneration of neurologic and other body systems such that he describes the toxic effects of narcotics similar to accelerating the aging process. There's a big risk of dry mouth and tooth decay. And there's also a risk of significant interactions with other medicines that you might already be on for other problems. Last but not least, it's very common and expected that you're going to become dependent on these medications. Your body's actually going to need the use, and if you stop the use abruptly, you will go into withdrawal. This is something that's going to have to be managed by a healthcare professional. So this is a big deal. And when I talk to patients about the risk-benefit profile of these medications, a lot of times I hear, well, that's not me. I understand your concern. But you've also got to understand that these medications don't discriminate. They'll do this to anybody. And the fact is, some people do get improvement in their pain. But in this day and age, we can't identify who those people are. So there are a lot of people out there that may not be meeting our treatment goals, which again are decreased pain, improvement in function, and better quality of life. And when we think about those benefits and how we're not able to provide those, and the dangers that are so significant with these medications, I would really encourage anybody who's thinking about using these medications on a long-term basis to have a frank discussion with their physician. It's difficult because we want to help you. We want you to experience less pain. But there are many reasons why we're becoming more hesitant as healthcare professionals to write these prescriptions. They're dangerous medicines. Please talk to your doctor.